Despite a stay order being issued by the Colombo District Court on Thursday, ordering the Government Nursing Officers Association to stop their strike for 2 weeks, the strike continued for a 6th day today, with zero regard for the difficulty it was putting the patients in. The excuse was that they haven't received the court order. The strike also continued in a backdrop where the President has issued a Gazette notification declaring the provision of healthcare as an essential service. Speaking to media, the representatives of the other unions engaged in the strike said that they will even look beyond Sri Lankan shores for ways to ensure that their demands are met.
අපි ලෑස්ති මැදට ඇවිල්ලා මේක විසඳ ගන්න කෙසේ වෙතත් මේ ගැටලුව රට තුල විසඳ ගන්න බැරි වුණොත් අපි අන්තර්ජාතික වශයෙන් ජාත්‍යන්තර කම්කරු සංවිධානයේ සමග ගනුදෙනු කරලා හරි විසඳ ගන්න දැනට තල්ලු වෙමින් ඉන්නවා.
Since the GNOA is conducting the strike while a court order has been issued to prevent it, former chief of the Human Rights Commission of Sri Lanka believes that legal implications would be inevitable.
Recently, stay order had been given, so therefore once it communicated to the leaders of these trade unions, they must stop the strike, otherwise it's a contempt of court. On the other side, we have seen basically Gazette has been issued as declaring this as an essential service. In the essential service also, if given some time and not reporting to work, and it also they may have a threat to their employment.
Meanwhile, there were also allegations that non-governmental organizations are orchestrating the strike.
අපිට සෑහෙන තොරතුරු ලැබිලා තියෙනවා අන්තර්ජාතික NGO කීපයක් මගින් මේ සියලුම වියහියදම් දරන්න කටයුතු කරනවා කියලා. ඒ වගේම වෘත්තීය සමිති නායකයන්ට ඒ අනුව හොඳ ගෙවීම් සිද්ධ කරනවා බවට.
ගුරුවරයාට පඩිය වැඩි කරනකොට අනිත් එක්කෙනා විරුද්ධ වෙනවා. හෙදියට පඩිය වැඩි කරනකොට විසුරුසේක මහත්තයා විරුද්ධ වෙනවා. ඔන්න සිස්ටම් එකයි මේක වෙනස් වෙ යුත්තේ.
This evening, however, the Government Nursing Officers Association suspended the strike, stating that they have received the court order. However, they said that the remaining 17 unions will continue the strike further. For 6 days, hospital services have been crippled with there being no health staff to provide services. But the bitter reality is that strikes in medical sector are all too common in Sri Lanka, with patients suffering at each and every turn. One expert believes that things must change, even from a rights perspective.
Sri Lanka, access to free health has been given for a long time, and these patients have a clean right to get their free health. Now we have seen Sri Lanka, there are two loopholes. Number one, Sri Lanka, there is no patient charter. Most of the countries, there are patient charters. In the patient charters, you have the patient's rights as well as responsibilities. So in that case, if a patient cannot get the free access to health, explicit access to health, then they can go under violation of the patient's charter. Number two, 1978 Constitution, there are fundamental human rights. Under the fundamental human rights, we have not seen right to health as a free right. So therefore, Sri Lanka, right to health is not a fundamental human right. So those two must come in future. When a constitution is going to be set up, it has to be incorporated in chapter 3 as a fundamental human right. On the other hand, GMO is very powerful and the other unions are very powerful, trade unions. But Sri Lanka patient rights organizations are not there, like in Western and India. So if these patient rights are there, they can directly go to courts and get a injunction, definitely, say order for these type of rights.